he hasn't had surgery yet, is that
It's okay.
That's-
It doesn't.
but there's not like a reason for why you would have surgery immediately versus surgery a little bit later?
Yeah, so a good question is, would it have mattered? Like if he's going to have surgery, why didn't he have it right away? Well, sometimes if it's a severe fracture dislocations, what are you most at risk of? Okay, let's assume no nerve or vessel injury. That's a separate conversation. But what are you most at risk of? I heard it out there. Fracture blisters, exactly. So when you blow it out like that, even if it's reduced right away and you ice it and you splint it, it'll blow up and you'll have fracture blisters. What are fracture blisters? Good question. So you know how when you burn, you get blisters? Well, in a fracture situation, you get so much swelling so quickly that the fluid seeps through the layers of the tissue and forms blisters. That is a higher increased risk of infection if you cut through fracture blisters. So either you operate right away or you let the swelling subside, settle down, get the imaging, get the test, realign it. Sometimes you may just do a closed reduction in the OR. So that means you line it up so the joint is perfect. You may put a fixator on it or you may put a cast on it. And then you elevate, ice, let the swelling come down. And sometimes you wait, 2-3 weeks, maybe less, maybe longer, to let the swelling subside. As long as the fragments and the joint are aligned, you can give it time. Now, ideally with fractures, especially in young people, you want to fix them within 10 to 14 days because they heal quick. Older patients don't heal as fast sometimes, but the main thing is don't put a 6 or 7 graphic on there, please. We got to change that. It's hilarious, but anyway. So the challenge, of course, is the healing potential and the healing capacity. And so just because he didn't have surgery right away doesn't mean there's anything wrong. It just means that's a decision by the surgeon and his treating physicians and team and his surgical team about what the ideal timing for surgery is. And it's not always right away.